Hello everyone, my name is Dr. Bagha, and on this channel we talk everything about kidney health, from prevention to treatment in a simple and a practical way. Alcohol is part of many social settings, in birthdays, weddings, weekend gatherings, and also sometimes during dinner with friends. For many people, having a drink feels normal, and often people assume if I'm not getting drunk, if I only drink on weekends, then alcohol cannot be harming me. But the truth is, alcohol affects much more than just the liver. It affects the heart, it can also affect the brain, it also affects the blood vessels as well. And yes, it also affects your kidneys. Now, this does not mean that every person who drinks alcohol will develop kidney disease. But what it means is that understanding the risks is very important because remember, many kidney problems develop silently. And by the time the symptoms appear, significant damage may already have occurred. So today, let's talk about how alcohol affects the kidneys, what excessive drinking does to your body, and how you can reduce the risk. So, before we talk about alcohol, let's quickly understand what the kidneys actually do. So, your kidneys are two bean-shaped organs that are located in your lower back, one on each side of your spine. And although they're relatively small, their job is enormous. Every day, your kidneys filter around 180 liters of fluid, removing waste products, balancing minerals like calcium, magnesium, phosphate, potassium, sodium, helping maintain the body's internal environment. They help control the blood pressure, your fluid balance, electrolyte levels, acid-base balance, and the removal of toxins. You can think of your kidneys as a body's natural filtration system. They are constantly working 24 hours a day, 7 days a week. And for them to function properly, they need three important things: a good blood flow, proper hydration, and a stable blood pressure. Now, unfortunately, alcohol can interfere with all three. So, how does alcohol affect the kidney? One of the first things alcohol does is that it increases your urine production. Alcohol acts like a diuretic. This means that it makes your body lose more water. And you may have noticed it after drinking alcohol. You often need to urinate more frequently. Now, the problem with that is when you lose too much of fluid, you tend to become dehydrated. And dehydration affects the kidney because the kidneys rely on adequate blood flow. So when the body loses water, the blood volume drops, less blood reaches the kidneys, and the kidney function can temporarily decline. Now imagine this happening repeatedly, week after week, month after month, and year after year. So what happens over time? Over time, the stress becomes significant. And this is more so in people who already have pre-existing kidney disease or conditions that affect kidney health. So what conditions affect kidney health? Diabetes affects your kidney health. High blood pressure also affects your kidney health. And remember, alcohol also affects the body's electrolyte balance. Electrolytes include minerals such as your sodium, potassium, and magnesium, among others. These minerals are very essential in the body for muscle function, maintaining the correct heart rhythm, and for kidney function as well. Excessive alcohol use can disrupt these balances, thereby creating an additional strain on the body. Then there's a blood pressure connection as well. And this is one of the most important connections between alcohol and kidney disease. Remember, the kidneys contain millions of tiny blood vessels, and these vessels help to filter blood. When the blood pressure remains high for long periods, these blood vessels, or glomeruli as they're called, become damaged. And when these glomeruli become damaged, the kidneys cannot filter blood efficiently. And research has now shown that excessive alcohol consumption can contribute to elevated blood pressure. It's not always immediately, but gradually over time. And that creates a dangerous cycle. High alcohol intake leads to higher blood pressure, leads to kidney damage, which leads to reduced kidney function, and your reduced kidney function worsens your blood pressures, which further leads to kidney damage. So it becomes like a vicious cycle. And that is why controlling blood pressure remains one of the most important ways to protect your kidneys. What about alcohol and liver disease? When people think about alcohol related damage, they always think about the liver. And that makes sense. The liver processes alcohol, but what people do not realize is that severe liver disease can also affect the kidneys. When liver damage becomes advanced, changes occur throughout the body. Blood circulation becomes abnormal, blood flow to the kidneys may decrease, and kidney function may begin to fail. This condition is called hepatorenal syndrome, which is a serious complication where severe liver disease causes kidney dysfunction. This highlights something very important, that the organs in your body do not work independently. The liver affects the kidneys, the heart affects the kidneys as well, and the kidneys affect nearly every organ system. So when one organ suffers, others often suffer too. So one challenge with kidney disease is that symptoms often appear late. Many people feel completely normal even while damage is developed. However, excessive alcohol use may contribute to the symptoms, such as people will feel fatigued, it will lead to dehydration, swelling of the legs, it will cause elevated blood pressures, leads to poor concentration, and worsening kidney function tests. Some people who take alcohol daily may also notice persistent thirst because remember, alcohol acts as a diuretic. Because of the electrolyte imbalances, it will lead to muscle cramps or reduced exercise tolerance. The important thing to remember is this: do not wait for your symptoms to appear. Prevention is always better than treatment. So, what is considered too much? This is a question many people ask. Doctor, how much alcohol is too much? And the answer depends on several factors. There is an aspect of your age, body size, medical conditions, and your overall health. For healthy individuals, occasional alcohol intake may not necessarily lead to kidney damage, but the risks increase significantly with heavy drinking, regular excessive drinking, and binge drinking. So, what is binge drinking? Binge drinking means consuming a large amount of alcohol over a short period, and this places sudden stress on multiple organs, including the kidney. And if you already have kidney disease, or if you have a background of diabetes, or high blood pressure, or liver disease, you should be even more cautious because your kidneys may already be under stress. So, how can we protect our kidneys? The good news is there are practical steps you can take. First, stay hydrated. If you choose to drink alcohol, make sure you limit the amount of alcohol you take. Make sure you drink water as well. Avoid binge drinking. Remember, large amounts of alcohol over a short period of time can be especially harmful. Third, always remember to monitor your blood pressure. High blood pressure remains one of the leading causes of kidney disease worldwide. Number 4, get regular kidney tests, especially if you have diseases like diabetes, high blood pressure, or you have a family history of kidney disease, because that increases your risk of developing kidney disease. And finally, drink responsibly or do not drink alcohol at all. The goal is not simply avoiding disease, the goal is protecting your long-term health. Small decisions made consistently over many years can make a huge difference. So remember, alcohol affects more than just the liver. Your kidneys are involved too. And understanding these risks helps you make informed choices. And informed choices lead to better health. So always remember, kidney disease often develops silently. So prevention matters, hydration matters, blood pressure control matters, and as always, moderation matters. Protect your kidneys today because the habits you practice now shape your health in the future. So if you have liked this video and would like to support us getting this message To those who need it, please subscribe, like, and share it with a friend. Thank you very much for watching.